Hi, my name is Patricia Fowler, and I'm in Nursing 916 Nurse Practitioner Roles in Primary Care, Fort Hays State University. This presentation is about the standards of care for nurse practitioner practice. Defining the standards of care can be a little bit tricky. Bluebird text defines it twice. Traditionally, it was defined as reasonable skill, ordinary care, and diligence that similar practitioners in like situations would exhibit. But it's no longer completely about what others would do. It's about what is best for the patient, utilizing evidence-based practice to provide effective and safe care in an appropriate time with positive outcomes to the highest expected level for the patient. Standards of practice is different from the nursing scope of practice. According to the American Nurses Association website, the scope is about what duties and tasks a professional is educated and competent to perform in line with the duties established by a license. Monitoring the standards of care for nurse practitioners can be complicated. Monitoring used to be a voluntary process. Whether or not the standards of care were being met depended on looking at the practitioner's practice, but only when a negative occurrence was known. Standards of care would traditionally be determined by the judiciary system after a lawsuit was filed. Standards of care may be monitored traditionally, and now, by professional societies, state laws and regulations, boards of licensing, accreditation bodies, judicial systems, and employers. Professional organizations, such as the American Association of Nurse Practitioners, have concerned themselves with having standards for the care they provide. The American Association of Nurse Practitioners has developed standards of practice for nurse practitioners, which will be discussed more on the next slide. State agencies and state legislation have developed nurse practitioner standards of care that's discussed within the legislation pertaining to nurse practitioner practice. Licensing boards are usually related to the statutes set forth by the state. They are concerned with authorizing licensure, reviewing qualifications, and following up on malpractice situations to determine whether action should be taken. Licensing boards will often use the National Practitioner Databank to determine whether or not action should be taken against the license of a nurse practitioner. They are not auditors, nor do they provide testing for individuals seeking licensure. Accreditation commissions, such as the Joint Commission, have traditionally been used for hospital accreditation. Now, it is becoming more common for the Joint Commission to accredit clinics and medical groups as well. Site visits by the Joint Commission ensure committee standards are met. It also looks at the ongoing educations of practitioners and whether or not practitioners are being held accountable to the competencies set forth by their employers. Judicial systems come into play in the standards of care of a nurse practitioner when a lawsuit is activated. Guilt of negligence can be determined by the judicial system. The judicial system uses an interpretation of the standard of care and may utilize expert witnesses to determine if practice guidelines were being met. The judicial system is helpful in setting precedents for future similar events. Employers may also develop standard practice guidelines. They may develop performance standards based on the expectations of the job. Some of these standards can be generalized. The American Association of Nurse Practitioners, also called the AANP, has developed standards of practice. These standards of practice include, first, the qualifications and educational requirements of nurse practitioners. In the second portion of the standards of practice for nurse practitioners, the AANP reports utilization of the process of care. This is utilizing the scientific process and the nursing process to treat patients by assessing, diagnosing, formulating a treatment plan, implementing, and evaluating. The emphasis of the NP's practice is also included here. Emphasis can include health promotion, safety promotion, education of patients, among many others that we are responsible for as nurse practitioners. The standards of practice for nurse practitioners by the AANP also outlines the responsibility of the nurse practitioner in providing comprehensive care and collaborating with additional practitioners and providers of care. The document also discusses the nurse practitioner's role as an advocate and their adjunct roles, describes the role of an NP in maintaining provision of quality health care by maintaining their certifications, quality assurance, and complying with regulations and other guidelines set forth by other bodies. While traditionally monitoring the standards of care for nurse practitioners fell on the previous groups about 2 slides ago, now providers, consumers, and agencies are starting to work together. They're determining a set base of care that should be followed. The National Committee for Quality Assurance, the NCQA, involves major employers, insurance companies, and the government. It provides accreditation to managed care organizations based on what represents the patient the best. The National Committee for Quality Assurance utilizes performance measures such as HEDIS, which stands for Health Plan Employer Data Information Set. HEDIS measures make recommendations such as cancer screening timelines and prenatal care, as well as other things. The Agency for Healthcare Research and Quality is a government agency. The AHRQ formulates guidelines for best practice by using protocols of care for certain diagnoses. Medicare reports measures regarding quality. Reimbursement from Medicare is dependent on meeting these requirements using the Merit-Based Incentive Payment System, or MIPS. The Joint Commission is included here as well as they transition to accrediting managed care organizations and clinics as well as hospitals. On-site visits from the Joint Commission sees that these certain guidelines are being followed. Healthcare is constantly changing. It's vital that we continue to educate ourselves and maintain licensure and certifications, as well as stay up to date on the latest guidelines. There are many ways to keep current in our practice. Research using books, newsletters, appropriate government and organizational websites, continuing education credits, managed care organization auditing guidelines and abiding by them, as well as accrediting body guidelines, standards set forth by the NCQA and AHRQ, state mandates that we must follow, as well as collaborating with other practitioners to provide the best care for our patients. The AANP offers resources to nurse practitioners on their website. Resources include links to clinical resources, journal articles, and even a digital toolbox with digital applications featuring evidence-based practice. Programs included in the digital toolbox include a program called Up to Date, a program called Dynamed Plus, and Visual Diagnosis. Credentialing is a way of forming a practitioner profile. It's used to see if requirements are being met for practice. Credentialing determines whether providers are in line with being able to provide care as part of a managed care organization. The Universal Credentialing Database is formulated by the Council for Affordable Quality Healthcare, or CAQH. The Universal Credentialing Database provides info pertaining to credentialing based on a set of standards formulated by guidelines important to MCO care management. Providing care under managed care organizations aims to provide quality and efficiency in healthcare. It may look at the nurse practitioner's utilization of services such as referrals and emergency services. Patient satisfaction is also looked at. Emerging standards of patient satisfaction keeps patients happy as consumers of healthcare. There are also informal patient satisfaction standards, and all of them are important regardless of how they're managed. Competencies. The NONPF, which stands for the National Organization of Nurse Practitioner Faculties, was developed in 1974. It's a committee for nurse practitioner educational excellence. The NONPF formulated guidelines for curriculum development to be sure that prepared nurse practitioners were receiving the highest level of education and are ready to practice. The NONPF also takes a role as an advocate in policy development, which will affect our future nurse practitioner practice. Specialties may require different competencies. The American Academy of Nurse Practitioners Certification Board provides competency exams for family nurse practitioners, as well as other types of nurse practitioners. The expiration date is in 5 years, and you must recertify your competencies to maintain your certification through the American Academy Nurse Practitioner Certification Board. Other examples might include the Oncology Nursing Society, which sets forth competencies for nurse practitioners involved in cancer care. Competencies can also be required by an employer. Employers often require competency evaluations to ensure that they are providing competent and safe care for their patients. These competencies may be based around specific procedures, and it helps to protect the nurse practitioner and the organization in the case of a malpractice lawsuit. Thank you for reviewing my presentation on the standards of care for nurse practitioners. It's vital that we continue to realize these standards of care and practice by them every day, so that we can continue to provide efficient, safe, and quality health care to our patients.